Abnormal bleeding. Why does it happen and what are some of the causes? If that sounds good to you, keep watching. Well, welcome back to my YouTube channel. My name is Dr. DuPont. I'm a board-certified gynecologic oncologist, and I'm passionate about teaching women how to improve their lives, and I believe that begins with great health. If you haven't subscribed or if you're new here, please press the button below and continue watching. So today we're going to talk about abnormal bleeding. The PALM-COEIN system is a system that classifies the causes of abnormal bleeding, and I have several videos that I've posted last year about one half of the PALM-COEIN system. So remember, it's PALM, P-A-L-M, and then COEIN, C-O-E-I-N, like a coin. Well, first let's talk about what normal is. So normal is having a cycle every month. Your cycles will last from 4 to 7 days. The bleeding will be bright red blood. And typically, most women will have cycles that last about 28 to 31 days. So what's abnormal? Well, abnormal bleeding is really bleeding that affects your quality of life. We describe it in medical terms as bleeding heavier than 80 cc's during your cycle, and we describe it also bleeding after intercourse, bleeding more often and every 21 days, and bleeding in between cycles. So those are what's called abnormal. When we talk about some of the symptoms of abnormal bleeding, we're really looking for causes of anemia. So I've had patients that have fainting spells, felt really weak and tired, sometimes are short of breath. Other symptoms are Pica symptoms such as craving ice, craving clay or dirt. Those are symptoms that you're really anemic. When you go to your doctor's office, some of the things that they're going to be wanting to look for are causes of abnormal bleeding, such as family history of bleeding disorders, heavy bleeding that's causing anemia. They may talk to you about, have you ever had any heavy bleeding after surgery or after a miscarriage or after childbirth? Did you have heavy bleeding after dental surgery? Those are something that's really important. And when patients tell me they're passing big clots or big clumps of tissue, to me that's a red flag that they're bleeding too heavy. As well as women that'll say, my bleeding's so heavy I have to use a pad and tampon together to prevent accidents. So that is when the bleeding is way too heavy. So those are some of the things that we're looking for in the clinical history, signs that there's a bleeding disorder or a problem causing too much bleeding or anemia. So I talked about the PALM-COEIN system last year in a few of my videos, and you can keep watching this video and some of those videos will pop up. But the P is for polyps, the A is for adenomyosis, the L is for leiomyomas or fibroids, the M is for malignancy, whether that's cervical dysplasia, endometrial hyperplasia, or uterine cancer, or ovarian, usually ovarian cancer, but endometrial cancers. So I talked about those last year, and I have several videos on each one of those. Today we're going to talk about the COEIN system, so the last part of the PALM-COEIN. Now, the International Federation of Gynecology and Obstetrics termed the PALM-COEIN system in 2011 as a way to classify abnormal bleeding, and also for a way for us to describe it. So, we may put AUBO as abnormal bleeding due to ovulatory dysfunctions, AUBL for leiomyomas or fibroids. So those are a lot of the common causes. So that's kind of how we document it in our charting, but also it's a good guide to talk about, what are some of the causes. So again, the PALM-COEIN system is what we're describing today. So the C is coagulopathy. So coagulopathy is usually there's some cause for you to bleed more heavily or more often than normal, and then your normal coagulation factors don't stop it. So one of the most common causes of coagulopathy is von Willebrand's disease. So they say 11% of all women with heavy bleeding have von Willebrand's disease, and 1% of the US population will have von Willebrand's disease. And what that is, it's an inheritable coagulation disorder that causes this von Willebrand factor to either be not present or be in low numbers, so that when you are having some insult or injury, you can't stop bleeding like others would. So there's a problem with the platelet, forming the platelet plug so that you can stop bleeding. And typically, those patients will refer to a hematologist, and really what a hematologist will do, will evaluate the type of von Willebrand disease. There are several types, and treatment depends on the severity. I have some patients that have very mild symptoms and they don't need treatment at all. I do have one patient in my practice with this disease, and when she had surgery, I sent her to the hematologist to kind of give me instructions on, how we can reduce her risk of bleeding during surgery. And that's really a very important factor to think about. It has been said that 20% of adolescents with prolonged heavy bleeding at the start of menses probably have a coagulation disorder. So when menses began, the fancy doctor term is menarche, and that's just the beginning of their cycles. Most people, it's around ages 10, 11, or 12. And so 20% of women that are very young, or young girls, when they start having their cycles that have really heavy bleeding, will have a coagulation disorder. Some other disorders are disorders of platelets, disorders of prothrombin deficiency, and then chronic anticoagulation or other causes, whether it's liver disease or some other cause that your platelets just aren't working or your coagulation factors aren't working properly. So the O in the COEIN system is for ovulatory dysfunction. Now, I see this quite often. This is seen a lot at the extremes of the reproductive age, whether your cycle's just started or you're in the perimenopausal part. Well, a lot of times we'll see the ovulatory dysfunction. One of the most common causes of ovulatory dysfunction will be polycystic ovarian syndrome, and those are women that for some reason are ovulating every month. One of the hallmarks of ovulatory dysfunction is when you're making too much estrogen and the progesterone is not being made in sufficient levels to make the bleeding pattern more balanced. So with PCOS, a lot of those patients are obese, not all of them, but a fair number. And sometimes they notice that they lose just, 5 pounds, 10 pounds, their cycles will come back to normal. I have patients tell me, oh yeah, I gained weight and then my cycles changed. Well, a lot of the time it's because of that imbalance with ovulation. And I do tell patients that, we do make a little bit of estrogen in our fat cells called estrone. It's a very weak estrogen, but we do make it ourselves. So the more fat cells you have, the more estrone, and the more risk you have of having that imbalance between estrogen and progesterone production. So ovulatory dysfunction is the O. Other causes of ovulatory dysfunction are hypothyroidism, which is a low thyroid hormone, or hyperprolactinemia. And that's a prolactin hormone called prolactin that's made in the posterior pituitary. Now, when that level is too high, you can have also changes in your menstrual pattern. So a lot of times, we'll check a TSH level and we'll check a fasting prolactin level to see if someone has that disorder. And typically, if they do, you just treat those hormone levels, and usually the bleeding pattern gets back to normal. Another disease that can cause anovulation is hypercholesterolism, which is known as Cushing's syndrome. It's a rare cause of abnormal bleeding, but it is another cause, and so that's something that your healthcare provider will definitely look at. And then the E in the COEIN system is endometrial. So sometimes this is more of a diagnosis of exclusion. We've looked at everything else and nothing else is causing your bleeding, then we think maybe there's something wrong with the endometrial lining or the lining of the uterus. Usually it's a diagnosis of exclusion. Reports have shown that patients with like a chronic chlamydia infection can cause abnormal bleeding. It's not common, but it can happen. And so that's the E of endometrial. And then the other one is iatrogenic, so medication. So a lot of times, we'll have patients with abnormal bleeding. It's because of some of the medicines they're taking. Birth control pills can cause abnormal bleeding. I often see breakthrough bleeding while I have patients. Sometimes they're young patients that start hormones or start birth control pills and they're having breakthrough bleeding. A lot of times what we'll do is we'll switch the type of birth control because there's so many different brands. They have different levels of estrogen and different types and levels of progesterone. So a lot of times we just have to find what works for that particular patient. But breakthrough bleeding is very common with birth control pills. A lot of our long-acting progestins can cause abnormal bleeding. I remember when I was a resident, one of my colleagues had an IUD and she just kept bleeding and bleeding and bleeding, and finally just had to have it removed because she just had so much abnormal bleeding. So long-term birth control can also cause it. The Nexplanon, the one that goes in your arm, can also cause it. 40% of the patients with the Nexplanon can have irregular bleeding. I have patients, I've seen them with Depo-Provera, where they're on Depo for a long time, they may eventually start having some breakthrough bleeding. Usually we'll treat that by adding supplemental estrogen, but it depends on the cause. But just keep in mind that medications are another cause of abnormal bleeding. And then the unknown, the last part is unknown or not otherwise specified in the PALM-COEIN system. And that's usually due to trauma or foreign object. I've had patients lose things in their vagina from time to time. It's uncommon. They usually go to the emergency room. But a lot of times, foreign objects can cause, whether it's a tampon that someone forgot to take out and it was in there. Usually it'll cause an odor and an infection, but it also can cause abnormal bleeding. Another one I've seen is, patients, I had one patient that went on her honeymoon and had, a lot of intercourse and actually had trauma to the vaginal wall. So lacerations of the vagina or any kind of trauma can also cause abnormal bleeding. Well, I hope that was helpful for you. So today we talked about some of the most common causes of abnormal bleeding, and we reviewed the PALM-COEIN system. If you're still here with me to the very end, thank you for continuing to watching, and watch this video next for more information on other causes of abnormal bleeding. Thank you, and see you in the next one.